Hi everybody, it's been a while. Hope everybody's okay. I decided that I probably skipped over this and it should have been the first one that I did, but it just occurred to me, so I thought I'd throw it out there. Working with children is going to be one of your most important parts of doing pediatric echoes. And I think a lot of people, if you're an adult tech and you're not used to working with children, especially if you don't have any of your own or if it's just new to you, there are certain things that you really have to know to make yourself familiar and comfortable when you're working with a child. I will tell you that there are certain things based on age groups that will help you. 0 to about 3 months, you won't have a problem because the most the baby can do is maybe roll a little bit to the side. Now they can all cry, and sometimes you have to do the echo with them crying. I believe wholeheartedly in pacifiers, so if the parent doesn't have one, sometimes I will go get one and just tell the parent it's kind of necessary for the test, and we'll just take it away when the study's done. But a pacifier sometimes will just settle the child down and things will be okay. If you can get warm gel for a child, especially that age, 0 to 3 months, that will help immensely, because if you got a child sleeping and all of a sudden you hit them with the cold gel, they're going to awaken rather quickly, and you're going to wish to God you had warm gel. So that's the 0 to 3 months. Now 3 months to 6 months, you start getting movement where the child can roll over and things like that. At least, the 6-month age, they start rolling a lot. If you have mom right there or dad right there who can entertain the child, that's very important. Don't throw the parents out of the room. You need them. So if you can get them to kind of entertain, I've seen some keys work really well. Just shaking the keys back and forth and making some noise is really good, and it works really well. So what I would do is, just tell the parents to bring whatever toy the kid likes, and from there they can do that. And also a bottle works great. If you can get the child to eat a little bit while they're getting the echo done. If the child needs to burp, you need to stop the echo and let the mom or dad burp the baby, or if you have to, you do it yourself. If you fill that baby up with formula and then do a subcostal view, you will see that formula come right back up. So if I were you, I would be careful and make sure you burp the baby, otherwise you're going to have a mess on your hands. So let's go on to the next age group, which is 6 months to a year. Now this is when it starts to get difficult. You will see that the movement of the child is greatly increased, and if this baby does not want an echo done, you are going to struggle, because you're going to have to figure out a way to keep the baby entertained. At this point, at 1 year old, I've seen an iPad work pretty well. If you have the parent hold it in front of the child, there are so many videos out there, especially on YouTube Kids, that'll even entertain a 1-year-old. I would recommend either having one in the Echo Lab that you can use, or asking the parents to bring one with. I think it's important when you schedule the baby to give them a call, the parents a call, and tell them, if you have an iPad, bring it with, because it may help with the child. Here's a couple of cuties for you. You're starting to get into this age group where, the 1-year-old can walk and talk, or not talk, but at least make some words, and the baby, or the child next to this baby right about here, this one looks like she's about 3. So you've got a 2-year-old and a 3-year-old. So these two children together are going to be your hardest echoes to do. And the reason why that is because they have free will under their skin, if you know what I mean. They can really make your life miserable or make your life real easy. Now, this is where the iPad comes in, or the phone, the parent's phone, comes in real well. You know, before we had all this technology, I knew a guy at University of Chicago who basically had the idea that his children would sit in front of the TV and watch videos and not move. We used to give these kids chloral hydrate to try to get them to go to sleep. And then someone realized that an ecotech shouldn't be given chloral hydrate, and I think that's a good idea because the child should be monitored afterwards. So they started putting a TV with a bunch of videos that they had in the Echo Lab at University of Chicago. I wish I could remember the guy's name. He's a real nice guy. I think he's up at University of Wisconsin now. If he would put in a videotape and just hit play, and that child would be mesmerized by what was on the TV and hold still for the whole echo. This group, this 2- and 3-year-old group, so you've got a 2-year-old and a 3-year-old, and if you can somehow find a way to show them a video, they will hold still, and it's pretty amazing to watch. Now, it's very, very important if you can somehow talk your manager or your administrator into having your own DVD player and your own TV there, just in case the parents forget to bring something, like, you know, or they don't have access on their phone. You know, not a lot of people in areas where, you know, the what do you call it, the income is low, and they don't have these kind of toys. They're just barely getting by with a phone that doesn't show videos. So if you have it in the lab, then you have some backup. I tell you, one of the easiest things you can do is go to garage sales and pick up children's DVDs. They'll cost you $1, maybe $2, and just find some Mickey Mouse, some I don't know about Barney, he's a little older now, but Barney was popular when my kids were little, so that gives you an idea how old I am. But any kind of childhood video that really would, you think, maybe keep the child's interest will help. And you just have a little TV. You can get like a little 13-inch TV, put it on a cart, and put the DVD player underneath it and hit play, and you'd be really surprised how you can get that child to hold still. You may still need the parents to help, but it's very, very impressive. Alright, found a couple more cuties here. So you got a big sister and a little baby. I don't know what that one is. Maybe a girl, maybe a boy. But anyhow, sometimes even having a big sister or a big brother in the room with a 2-year-old or a 3-year-old, you obviously, with a baby this small, you wouldn't need that, but sometimes the comfort of the voice, or just having the older child try to entertain the younger child, can be a big help, because you know how younger children look up to their big brother or big sister, and sometimes they can calm them down, and it's really important to do that. I would also recommend that you do most of your echoes, if possible, in the echo lab where you have all this stuff set up. Obviously, if you have to go upstairs to a PEDS ICU, or maybe to the floor because the child has a bunch of IVACs hooked up, well, just ask if they have an iPad up there, or, you know, most pediatric departments will have their own iPads and own video players, whatever they need. So you're going to have those in the room to help. But it's important to develop an idea of how old the child is and what you're going to need when you go up there, so that you're prepared. And again, if the parent's in the room, that's great. They can use their phone. They know what the kid likes, and it's easy. If the parents aren't in the room, then it's kind of guesswork. But YouTube Kids, you can find something that'll entertain the kids. I'm telling you, my granddaughter is 3 years old, and she works the phone better than Grandpa does, and also can find videos on YouTube Kids that she likes without even asking anybody. She just finds them, and it's beyond me. I'm lucky I can push the buttons and get the person I want to call. So anyhow, that's the advantage to having a phone in the room or an iPad in the room. Like I said before, I'm sorry I'm rambling a little bit, but it's very, very important for you guys to remember this stuff. Working with children is a lot different than working with adults. You know, you can tell an adult you need them to lay on their left side, and we need you to be kind of quiet for the test, and, you know, please don't hit me, whatever you have to say. But, you know, it's just a matter of the difference between a child and an adult is whether or not you can communicate with them. Okay, I put a couple of older kids up because I think it's important that you know that older kids still get scared because, you know, when they go to the doctor, they're getting vaccinations and stuff like that. So you can get a 7-year-old who's very scared, and if you don't know how to comfort them, you're going to run into trouble because they could get up off the table and walk away, you know. I might even flip you the bird, you never know. Anyhow, making this child comfortable may include using a computer or, like I said, an iPad. You know, obviously here they have an Apple computer and they're enjoying it. An iPad will work better. But remember, these kids need to see a silly face or hear a silly joke or something of that nature at their level, and you have to smile a lot. Please remember, these are kids. They want to see smiles from people. If you're in a crabby mood and, you know, maybe your boss just walked in and said something really stupid, which happens a lot, remember that your job is to make that child comfortable, which means you're going to have to smile, you're going to have to put on that fun face to make this child understand that this isn't going to hurt. You know, you tell them that flat out. This is not going to hurt. We're going to be done really quick, and I promise you that as soon as we're done, I'll tell you, and you won't have to worry about it anymore. And they understand that. And if you do it with a smile, they're going to let you go ahead and finish the test. Okay, now let's look at probably the most important view when you're working with kids, and that's the subcostal short axis view. Oops, sorry, hit the wrong button. The subcostal short axis view and the subcostal long axis view, which they're showing here in this picture. This is the regular subcostal view. These are pediatric views, so they're upside down. So you're going to have to get used to looking at that. You have to know what you're looking at anatomy-wise. This is a great picture that shows the planes and tells you what chamber is where and what vessel is where. It's something worth enlarging on your computer and really taking a look at. I wish I could give credit to the person who did this PowerPoint. It's actually very good. Maybe you can find it, just type in PowerPoint presentation on pediatric echo, and once you see this blue screen down here, you know, you'll know that this is the same one. A lot of it is written, there's not a lot of pictures, but it is a really good explanation of it. And again, I wish I could give credit, but I'm just not that talented with the iPad, so sorry. But this will show you those subcostal views, and it's very important because the first thing they want to know is what's the situs of this child. You know, is the heart on the correct side of the chest? Are the vessels coming off the proper chambers? You know, is there an ASD, which you would see here in this view here in the third view? And you know, in the short axis view down here, you could see how the function is. There's a lot you could tell by these first views. So very important to get this first, and then you can go on with your regular echo, long axis, short axis, 4-chamber, which will be upside down. I'll show you a picture of that real quick. It'll be upside down, and you know, you can get an idea of what's going on there too. Okay, so last view that's a little bit different. This is the 4-chamber view. It's upside down, but this is how they want to see it, so you're going to have to get used to looking at it this way. Everything is laid out right on the photo. You can see where everything is. So it's important to know how to get this view because it's really going to show them especially children that have enlarged chambers. It'll show them that, and mitral valve leaking, tricuspid valve leaking, maybe even a ASD or a VSD, even though the flow will be perpendicular rather than parallel. But sometimes an ASD, let me just quickly put this up, or a VSD, I'm sorry, VSD might go like this. And if it goes like that, you'll see flow that'll be very turbulent going this way. And that's because it's not perfectly parallel to flow, but it's trying to be. So it's important to get this view. It'll help you a lot. So work on this view, and again, just get a regular 4-chamber view and then hit the button that flips it upside down. And then angle up to get the aorta in, and you're on your way. Alright? Okay, so let's go over the last couple of points and then we're done. Alright, number 1, take your time. Don't be in a rush to finish these. I've seen pediatric echoes take almost 2 hours. You may not have that kind of time in a day to do that, but if you really want to do a good echo, time shouldn't matter. And if somebody gives you a hard time, you know, show them what they need to see in regards to how long a pediatric echo will take. Okay, next one is smile, act silly, make it fun for them. You're going to have to change your style, and remember that this is not an adult, it's a child. You can act silly, you can put on a funny face, you can do whatever it takes to make this child feel comfortable. If the child is crying, try to distract them so that you can do the echo without them crying. It's very hard to do an echo with a baby crying, or child crying, or getting up, or trying to do whatever they want to do. It's just not going to work. So have mom and dad be in the room so they can really help. They know what distracts the child. They know what'll help. They'll whip their phone out, put on a video, and it'll work great. Number 5, remember, this is a child, or it's a child, and it's a lot different than doing an adult. You're going to have to learn the tricks of the trade, and you'll find things that'll work. Remember, a bottle works for an infant that's crying. Remember that, you know, a video works for a 2-year-old, and you're going to have to remember that you're going to have to talk to a 6-year-old or a 7-year-old and let them know this isn't going to hurt. It'll be easy. And then the last thing I put here is a link to, and I'm sorry, you may have to copy and paste it, but it's a link to the American Society of Echoes guidelines for a pediatric echo. It's kind of boring reading, but it will tell you exactly what you need to know about a pediatric echo. So I'm sorry this went so long, but I hope you enjoyed it, and I hope you got something out of it. And we'll work on some new stuff for the next video. Have a good day.